So today we're going to talk about autoimmune disorders. This is just going to be a general overview. Some we have already talked about, and some you may talk more about in oral path. So to review, the immune system protects us from microorganisms that are trying to enter our body. Remember, our body's the perfect temp that they love, that warmness and the warm and wetness. And this means that our immune system has to create antibodies that attack these substances that they detect as non-self. When working correctly, our immune system is and should be able to tell the difference between self and non-self cells. So autoimmune disorders are diseases caused when the body produces an inappropriate immune response against its own tissues and organs. This destruction caused by formation of auto antibodies. Auto, remember, means self. Self antibodies creates antibodies against itself. Some autoantibodies are easily detected by lab tests. Some autoimmune disorders are much more tougher or tough to detect. The etiology is really considered unknown. We do think that there is a genetic predisposition, and many run in families, but they don't always manifest as the same autoimmune disease. So say I have eczema, somebody in my family or one of my children may have lupus. So there's that genetic predisposition, but it isn't for the disease, it's just for the autoimmune disease. There can be environmental triggers. Exposure to certain viruses or to a toxic chemical can then create this cascading of events. Possible hormonal component, because it is 75% more common in women. So classification, there's specific, so a specific organ or tissue. Response attacks just one particular body organ or tissue. So think diabetes type 1, Hashimoto's thyroiditis. Systemic is across multiple tissue and organs. So the response attacks multiple tissues and organs. It's much more difficult to diagnose and treat, and it can cause widespread damage. So facts, most have no cure. Some may disappear on its own, but that is very rare. Many may have periods of flare-ups and remissions. Many have chronic symptoms with progressive worsening over time. Most frequently, it affects our endocrine glands, blood components, connective tissue, skin, muscle, and joints. So treatment, it really depends on the tissue or organ involved. So think diabetes, treat with insulin. Hashimoto's thyroiditis, you're given a thyroid replacement hormone. We also have drugs to turn down or shut off the immune response. NSAIDs, those are our non-steroidal anti-inflammatory drugs, but they're given at prescription strength. So prescription strength ibuprofen, for example. Corticosteroids, so steroids in larger doses to really turn down that immune response. Also, there's immunosuppressants like methotrexate and Sandimmune. This Sandimmune is one of the 3 drug categories that causes gingival hypoplasia, and that's something that we must be aware of. So the impact on the dental setting, impact of the autoimmune disorder, it really depends on that particular disorder. So NSAIDs could cause stomach upset. Corticosteroids could also mask progressing perio disease because it's lowering the it's an anti-inflammatory. Immunosuppressants, they can cause a bleeding disorder. You can have almost like little bruises inside the mouth, little petechiae, those are small. Ecchymoses is the medium size, and then purpura is the larger size. You can also have an increased possibility of an infection, like a yeast infection in our mouth, and then that gingival overgrowth. So we'll go through some of the most common. They're more than 1 in 100. So we have psoriasis. So psoriasis is an immune-mediated disease. What that means is it's a disease with an unclear cause that is characterized by the dysfunction of the immune system that causes inflammation in the body. So what happens is you may see these visible signs of inflammation, such as raised plaques. Plaques may look different for different skin types and scales on the skin. Our body usually sheds its skin every 30 days, every month or so. What happens is this triggers our skin to speed up the growth of the skin cells. So instead, you're replacing your skin cells every 3 to 4 days. However, they're not shedding, so they pile up on top of each other, and that can cause that scaling look, but it can also affect other organs and tissues as well. We have Hashimoto's thyroiditis. So autoantibodies attack the thyroid gland, which results in that destruction of the thyroid, which causes a hypothyroidism, so lowered thyroidism. This often results in a goiter, which is that growth in the neck. Even though goiter is most common in hyperthyroidism, this is a unique feature of Hashimoto's. We have celiac disease. This is an allergy to substances containing gluten, resulting in an autoimmune response. The villi in the small intestine destroyed, resulting in the malabsorption of necessary nutrients. We have Graves' disease. So this is an autoimmune response that leads to overactivity of the thyroid gland. So we have hyperthyroidism. These autoantibodies bind to the receptor that's responsible for releasing the thyroxine, so it releases more than we need. This causes a diffuse gaiter, weight loss, heat intolerance, exophthalmos, which is the bulging of the eyes that you see here, and tachycardia. Tachycardia is an increased heart rate. You can see this lady's neck up here is much bigger. We have rheumatoid arthritis. Autoantibodies attack the synovial membranes, which results in the destroying of bone and cartilage. And then over time, you lose joint mobility. You can see this hand down there. It looks really uncomfortable. It can also affect other parts of the body, but it usually starts in the hands. There's also a juvenile version that kids can get, and it does affect women 3 times more. So then we have our second most common autoimmune diseases. This is 1 in 1,000. We have diabetes type 1. This is insulin dependent. The antibodies destroy the beta cells of the pancreas. These beta cells are responsible for releasing insulin. So instead, the glucose remains in the blood, resulting in hyperglycemia. If insulin is not there, the glucose is unable to enter the cells. So these people are dependent on insulin. Vitiligo, so this is a skin condition, and it's due to the destruction of melanocytes. So it results in the depigmentation of patches of skin. You can see this girl down here. She has much lighter patches on her skin, and it can also, you may see it on mucous membranes in the mouth. So the buccal mucosa, you might see it on the attached gingiva, and many also have another form of an autoimmune disease along with vitiligo. We have pernicious anemia. So these are the parietal cells of the stomach. So they're found inside the stomach. And these cells are very responsible for the absorption of vitamin B12. So what happens is these autoantibodies destroy the parietal cells. And when they destroy these cells, then we're unable to absorb that vitamin B12, which is a critical component of the development of our red blood cells. So when you hear anemia, think low red blood cells. Side effect orally, you may have a very smooth or what's called a bald tongue, which you will see over here on this picture. So then we have multiple sclerosis. So that's inflammation and scarring and destruction of the myelin sheath that is in the nerves of the central nervous system. So you can see this damage here. So myelinated nerves, they carry messages to the brain. And the brain, they can get there much faster because it can leap and hop over these myelinated sections. But when this myelin is destroyed or scarred, that message then has to travel all the way along the nerve. So it gets to the brain much more slowly. And the symptoms can really vary widely. And this does have periods of remission and flare ups. So the third most common, which is 1 in 10,000 people, we'll get into a few of these. We have Addison's disease. And Addison's disease is autoantibodies that attack the adrenal gland. So the body is unable to produce adrenal hormones, especially cortisol. So this is resulting in weight loss, muscle fatigue, low blood pressure, and they're really unsure why, but hyperpigmentation as well. So these people are on replacement drugs, steroid hormones for the rest of their lives. We have Crohn's disease, which we've talked about in the past. So the next couple are going to be inflammatory bowel diseases. This is inflammation and ulceration of the GI tract. And remember, it can happen anywhere from the mouth to the anus. But the most typical site is the ileum and the small intestine. But this can also have oral lesions. These kind of pebble or cobblestone-like lesions can also be seen in the mouth. We then have ulcerative colitis, inflammation and ulceration of the GI tract. This is limited only to the large intestine and rectum, and we've already talked about this, so we won't go much into detail. We have bullous pemphigoid. So this is an autoimmune disorder of the skin. You can see here it attacks the epithelial cells or the basement membrane. It may also be seen as intraoral lesions, but you can see it kind of gives a really blistered vesicle look on the skin. We have lupus, and lupus is an autoimmune disease of the connective tissue. Its autoantibodies attack the nucleic acid of cells. The cutaneous form is usually confined to the skin, and it causes this butterfly appearance rash on the face. But there also can be a systemic form that can affect anywhere of the body, and that makes for much different symptoms as well. Myasthenia gravis is autoantibodies that attack and block the acetylcholine receptors on skeletal muscles. This can result in muscle fatigue, especially facial and swallowing muscles. So you can see the droopy eyelid here, ptosis, dysphagia, double vision, and a myasthenic crisis. So this crisis is when there's so much fluid and the patient begins choking, they're having difficulty breathing. That can truly be a emergency. Scleroderma, this is the most deadly autoimmune disorder. So you have thickening and hardening and tightness of the skin, but it can also be blood vessels and organs. So it's most deadly if you see it internally. Generalize the thickening, hardening of the skin. If you think of this happening, you might see kind of tightness of the skin, which we can see here. However, internally, think of it happening on your lungs. So if all of a sudden your lungs are having all of this excess collagen formed around them, it's going to make them hard. And we want our lungs to be nice and bouncy and fluid so that they're able to push air out. And instead now they're hard, which makes it one of the most deadly autoimmune disorders. We have Sjogren's syndrome, think dry, very dry. So this is an attack on salivary and lacrimal glands, extreme xerostomia, dry eyes. We have the enlargement here of parotid glands. These patients are definitely going to need our attention because they have no saliva. 30% have a systemic involvement with the lungs, the kidneys, blood vessels, and muscles.